Hello, I'm Christine Hazard, President and CEO of Berkshire United Way. Welcome to Community Matters, our monthly show designed to bring you up to date on the efforts of Berkshire United Way, our funded partners, and others in the community to improve lives in Berkshire County. Our focus in terms of priorities are education and employment, and we are really looking for sustained change, not quick fixes. Today I'm really excited to have the opportunity to highlight the Pittsfield Prevention Partnership and all the array of activities and events that they have going on. And I've got three great people here with me who I'll introduce in a minute in terms of their role with the Pittsfield Prevention Partnership. One of the things the partnership does is they administer, with the help of the school systems of course, a prevention needs assessment survey every 2 years. And they look at the addictive behaviors, alcohol, drugs, gambling, things like that, and get input from 8th, 10th, and 12th graders on their use. Unfortunately, in Berkshire County, we really do have a challenge, and that's something we want to talk about today in terms of how all of us as a community can deal with that. I want to start with just a couple statistics that are a little maybe alarming or disturbing. In the 2009 survey, 45% of 8th graders and 82% of high school seniors had already experimented with alcohol. As I'm sure we all know, the legal age of drinking is 21, so these are all young people who are well below that, and so there are legal issues, there are social issues, there are health issues, all sorts of things we'll talk about today. There's less of an issue with marijuana. Alcohol is the sort of drug of choice, if you will, but even with marijuana, 15% of 8th graders had smoked marijuana in 2006 during the survey, or not during the survey, reported on the survey, and who knows, and 53% of high school seniors had also experimented with marijuana. So that obviously, those numbers are still very stark and concerning, even though they are much less than the alcohol. The good news is, in the various years that we've been doing the prevention needs assessment, we have seen particularly the percentage of 8th graders using alcohol and marijuana come down since 2006. And I would like to say and believe and promote the Pittsfield Prevention Partnership's work in that. I think they have a lot to do with those positive results. So enough from me. I want to introduce my wonderful guest, Kelly Marion, who is by day the CEO of the Gladys Ellen Brigham Community Center, and also by day somehow she manages to be the chair of the steering committee of the Pittsfield Prevention Partnership. So you are a very busy woman, as I know.
I try.
And work real hard. Karen Cole is one of our own, Berkshire United Way's Pittsfield Prevention Partnership coordinator, and she's been doing that for 2 years now, doing an amazing job, and you'll hear from her. Yes. And then Brittany Nicholson, who is an amazing young person who I had the pleasure of seeing get an award recently, the Say It Proud Award. Also had the pleasure of seeing her at the Safe Prom do a little skit that was very entertaining, and she's going to talk a little bit about why she's involved. So I want to start with Kelly, and let's just sort of jump real quickly. Give us a little background of the Pittsfield Prevention Partnership, you know, what it's about, what it's trying to accomplish.
The Pittsfield Prevention Partnership started back in 2004. I've been involved since 2005. I've been the chair of the steering committee for the last 2 years. And back in 2004, when the Prevention Partnership formed, it really came out of some alcohol use by students in the community. And community leaders got together and said, you know, this isn't okay. We need to do something about this. So we looked to our partners up in the north and began working with the Northern Berkshire Community Coalition and Al Bashevkin and his group, and they really mentored us. And then the Prevention Partnership was able to get a federal grant through SAMHSA. I'm not even going to try the acronym.
We'll let Karen do that.
Substance Abuse,
Mental Health
Service Administration. We have lots of acronyms, as you know. And through the SAMHSA grant, we were able to work on a really strategic process, doing a Communities That Care program, working with the Western Mass Center for Healthy Communities, and really pulled together a large amount of people in the community from all different sectors, you know, faith-based community, from the city, from the hospital system, from a lot of the nonprofit agencies like my own. Also, you know, a key partner is the Breen Center. Yeah. And everybody came together. We did the prevention needs assessment. We looked at what results came out of that, and not just looking at the use, but also looking at risk and protective factors. What do we need to do in this community to hold children in a different way and to really create a comprehensive piece around them so that they're steering clear of substance use, be it smoking, alcohol, marijuana, or other drugs, which is obviously becoming another issue more and more in the media. So that's sort of where the Prevention Partnership came from and sort of where we stand today. We do have a strategic plan that we follow that goes over all of the initiatives for the steering committee. We pull in lots of different entities to work on those initiatives, and Karen works very hard doing all that for us. And I really think the positive thing is we are making headway.
Absolutely, absolutely. I think there's definite evidence of that. What would you say is the real key role of the Prevention Partnership? What's the primary thing you're really trying to accomplish through all these relationships and all this coordination?
I really think it is about the name. It's about prevention through partnership. I really think it's different people in the community working together. It's youth, it's parents, it's community members, community leaders, the school system, really coming together, looking at the issues, and really trying to make a sustained change. Like you said, we want this to be a community like our aspiration about live, working, and thriving for everybody who lives here. And you know, the hope is that our youth will grow up in this community, that will aspire to go to college in this community. We have a great, you know, the Berkshire Compact, yep. And that they'll aspire to be here, to raise their families here. And I think that that's really the focus, is creating a healthy community for all of us who live here. And I think that's what makes the difference, is really forming those alliances, forming those partnerships, breaking down territory issues. You know, we live in a county and in a community that's really got different sectors, and you know, there's always the territory, will they do that or they do that. We all need to work together on this issue.
Absolutely.
In order to create some change.
Because it's extremely important. And you know, I made the comment about the legal age of drinking and the fact that, you know, obviously kids are drinking before that. So there's a legal issue, which, you know, sure, most of us care about. But there's other reasons. I mean, I can see, having raised kids, and I know you've got young kids you're raising, or teenagers that you're raising, you know, all the pressure of, oh, every other parent lets it happen, and oh, it's no big deal, they're just drinking. It is a big deal. Why is it a big deal? Why should we care that a kid at 15 is binge drinking or getting involved in drugs?
I think when we look at what the 8th graders are doing, I have an 8th grader myself, just turned 14 at one of the local middle schools, and when you look at the results and you look at science-based research today, the younger a young person starts drinking, starts smoking, starts using any kind of substance, especially alcohol, the more likely they are to become an alcoholic, to become an addict. And we really need to get there earlier, get there quicker, and really get this in a mindset and really change the social norms in this community. I think we were at a meeting earlier today, and you know, there's 120 liquor licenses. And really creating what's okay and what's not okay. It's why a lot of the activity we form in our strategic plan focuses on that.
Right. And it's addressing the whole community norms around alcohol and what, like you said, liquor licenses, et cetera. It's what do we think is acceptable in our community. And I know there's people out there who may not have kids right now, might have grown kids and say, this is those parents' problems, but it has huge community impact as well, from our tax dollars in terms of paying for services for people who end up addicted, loss of wages for people who can't work because they have addiction. So I don't think we can emphasize enough how important it is. You mentioned Northern Berkshire Community Coalition mentoring you. I know that the Pittsfield Prevention Partnership is part of a county-wide initiative. Could you just mention that real quickly to show again that coordination that we're all learning together?
Absolutely. The Berkshire Youth Development Project, I became more engaged in that actually prior to becoming chair of the Prevention Partnership, because I wanted to get more involved in what was happening countywide, working with a countywide agency like I do. And we work with the Northern Berkshire Community Coalition, Al Bashevkin, Kate Merrigan, Lois Dwanis. We also work with the Southern Berkshire Community Coalition, with Tanya Hills. We work with the Railroad Street Youth Project with Lanny Moore and Brenda and her crew. And it's all about looking at positive youth development practices, looking at substance abuse in a county-wide way. We do a Youth Worker Summit. This year in September will be our 3rd year doing the Youth Worker Summit, where we talk about the prevention needs assessment results. We want youth workers to know this is the battle they're working on. These are the things that they need to put in place, and certainly having some kind of alignment about what a positive youth development practice is, what risk and protective factors we're really looking at, really creates a better opportunity for our youth to succeed. We also do the 411 and the 413, which is a youth conference that's countywide. It was held at Hancock-Shaker Village this year on April 1st. No fooling on the big snowstorm day that didn't happen. And that is a conference that focuses on youth and youth leadership, State Senator Ben Downing always speaks, and we have other presenters who really focus on youth issues and really educating youth about becoming leaders in their community, taking the reins, having a voice. And I think one of the things that the BYDP does, Berkshire Youth Development Project, is really gives youth a voice. And I think that's really important. All of the adults who are involved in that process really care about what youth have to say about these issues, and we're listening.
Absolutely, and that great information there to engage. I was talking about parents, it's the youth piece too, and we're going to hear from one of our great young people in just a minute. So Karen, we'd love to hear from you. The Pittsfield Prevention Partnership is involved in so many things. I said to you recently, I think in the office, you must be exhausted. And how did this happen that so much got squished into a short period of time? But you are working your tail off, and we thank you for that because it's all for the betterment of the quality of life in Berkshire County. Can you go through a few of the various strategies and maybe connect them to the risk and protective factors a little bit? Because I think that's jargon we're used to using, but it'd be nice to see what that really translates to.
Right. So first, I couldn't do it without the partnerships. It's not just me, obviously. Yep. It's working with all the groups that Kelly mentioned, and so together we're able to get a lot done. And around the prom and graduation season, we really are trying to put a number of strategies into place that address the community laws and norms risk factor. So this is something that came out of the Prevention Needs Assessment Survey. We know that kids don't get the message enough that the community really cares that they do not engage in substance use. So we have a number of strategies in place that get that message out. So for example, this afternoon, Brittany and her crew from the Red Cross Youth Leadership Program will be doing sticker shock in participating liquor stores. We have about 18 liquor stores lined up.
That's fabulous.
We'll be doing about half of them today. Another half of them we'll be doing on June 6th with the Students Against Destructive Decisions chapters from the Pittsfield Public High School. And what the kids do is they go into the stores and they put stickers on all the multi-packs of beer and wine coolers, and the stickers say it is illegal to provide alcohol to someone under the age of 21. So that gets the message out that way. We also have a shoulder tap survey coming up. Again, with the Red Cross, we're really happy to be teaming up with them this year. And a few teenagers will be standing out in front of the liquor store. We have an undercover police officer, another key partner, in the parking lot just to provide security and support. And it's a survey, but the customers don't know it's a survey.
It's a surprise survey.
It's a surprise survey.
Like a mystery shopper.
Yes, very similar. So the students will approach customers as they're going into the store and ask a hypothetical question: would you be willing to buy me some beer if I gave you some money? It's important that it's hypothetical because we don't want to get anybody in trouble. It's not a sting. Nobody's going to get arrested. But depending on how the customer answers, they'll get a no card, which thanks them for giving them the right answer.
Right.